Hello, my name is Adela Popa. I work as an associate professor in Lucian Blaga University of Sibiu, Romania, and I will speak to you today about returning to work after cancer in my country. On this slide you can see some details about my experience regarding return to work. Since 2013, for 4 years, I was a member in a COST network, which was on cancer and work. And this started my interest on this topic. Then I have conducted a project with national funding in my country, and also I have conducted a team of researchers on this topic of return to work after cancer in Romania, and this was actually the first study of this kind in my country. Currently, I work in another project. This is an international project with 6 European countries, and our focus is on how industrial relations and trade unions can be involved in returning to work after cancer. Me and my team, we have published several academic publications, and if you are interested in one of them, you can write me at my email and I can send it to you. And also we have elaborated several support materials for employers, for patients or physicians which are involved in the return to work process. And I will speak about them later in this presentation. Next, I will talk to you about the main problems regarding return to work after cancer in Romania. But first, I will try to build a little of context regarding my country. In Romania, we have a growing incidence for cancer and also growing rates of mortality in cancer. And as you can see, these numbers are quite high. The mortality and incidence for specific cancer in Romania is below the average in the European Union. Still, there are some types of cancer for which we have a rather negative situation. For example, for cervical cancer, Romania has the highest number of deaths in European country. And also we have a high number of avoidable deaths, mainly for cervical and lung cancer. Half of the cancer patients in Romania are working age cancer patients. So for them it is very important to facilitate return to work, because part of these patients, after the treatment is over, probably will want to return to work. There is a national program for oncology since 2001 in my country, but this program almost entirely is focused on the conditions for covering treatment from the Public Health Fund. This program has very little on prevention and almost nothing on cancer research, and also nothing regarding survivorship and work. In Romania, there is no national registry for cancer. There are only 2 regional registries which are functioning. So because of this, it is very difficult to implement adequate measures and policies for this problem. I have identified 6 problems regarding return to work after cancer. The first one is that we only have general provisions for resuming work, but there is no specific policy for return to work in case of cancer. So we don't have a policy detailing the actors their responsibilities, the measures or the interventions for return to work when the sick leave or the invalidity time are over. The second problem is that the return to work process after sick leave or invalidity has an informal nature. The only formal step required is the fit note from the expert physician of social insurance and also the assessment from occupational physician. But the whole process is not planned, and also it is very rarely phased, which means to have a part-time period and only after to have a full-time return to work. The third problem is that the policy framework for sick leave is quite detailed, also for the invalidity and disability, but there are no active measures labor policies after cancer. Therefore, the worker has benefits for staying in sick leave and in invalidity, but it is not encouraged to go back to work in any way. The fourth problem is that roles regarding return to work are distributed mainly to health professionals, and you can see which health professionals are targeted, but only marginally employers have a role in this process, and it's the same for the local public employment agency, and also no other actors are specified in policy. The fifth problem is that the lack of coordination between the actors and institutions involved in return to work process. The information on legislation is scattered in many policy pieces. It is very fragmented, and also there is no institution to coordinate all the process. Therefore, for a patient which comes back to work after cancer, it is very difficult to collect all the information or the legal and medical information he or she needs to return to work. And also there is no institution which could offer support in one place. And the last problem is that employers have only a marginal role in policy, as I said before. Actually, they have only one formal obligation. Therefore, the return to work process depends on the employer's benevolence. We have conducted interviews both with employers and employees, and unfortunately there are many employees which describe negative experiences regarding return to work. Therefore, employers are not always interested in facilitating this process. Next, I will talk about positive examples of return to work for workers with cancer. Although there are no positive examples which are visible at the national level, still there are some positive provisions in legislation, and I will refer about two of them. The stipulations regarding the recovery of work capacity, these are very important. Here we talk about medical and spa treatment for recuperation, and this is for patients who are coming back from the sick leave or from invalidity pension. And the second one is that the employer is required by law to provide an adjusted workplace or another job position to the employee which returns to work after being diagnosed with cancer. And this is also a very important provision in the Romanian legislation. Also, we have some positive examples from our interviews with employers and employees. We discovered that employers can find very creative solutions to offer accommodations to workers with cancer, of course, if they want to do this. Specific regulations about benefits for oncology patients. There are some benefits for diagnosis and treatment. For example, we have state-funded screening programs. In the present, there is a program for cervical cancer, which is delivered through the general practitioners. Also, in the past, in Romania, we had other screening programs as well. For example, for bowel cancer or for breast cancer. Another positive aspect is that treatment for cancer is covered in Romania from the National Health Insurance Fund, and also the breast reconstruction after cancer, it is covered. Then we have some benefits related to work. In Romania, there is a fully paid sick leave for employees with cancer for 1 year, with the possibility to extend this to 1.5 years. And I think this is a great source of support for cancer patients. Also, there is an easy process for applying for the invalidity pension, with a reassessment at every 1 to 3 years. Also, part of the cancer patients have the possibility to apply for a disability benefit, but this is not for all cancer patients. And also there are some regulations for workers with cancer which have a disability certificate. The sheltered units, the sheltered jobs, or the measures to incentivize the employers to hire people with disability. On what we are currently working and what are our plans for future, we are currently doing activities regarding raising awareness for this problem. We have several studies. We are currently involved in one study regarding return to work, and we are raising awareness by publishing academic studies on the Romanian population. Also, we have published several press articles in the Romanian press about this issue. You can see also in the first picture the brochure for employers which we have elaborated, and this brochure was of great help for our employers which have cancer patients. Also, we have elaborated a flyer for patients with cancer who want to return to work, and this is the second picture. And also we have done a policy brief containing all the important recommendations based on our studies regarding return to work. And we have sent this policy brief to the Ministry of Labor in Romania, to the Ministry of Health, and also to other public agencies which are relevant for return to work and which are interested in this topic. What about the changes that could improve return to work in Romania? Based on all the data collected from patients, employers, human resources recruiters, and other stakeholders in Romania, we can indicate some changes that can improve this process. First, our stakeholders suggested that Romania should establish an agency where the workers could access all the needed services for return to work in one place. For example, rehabilitation, counseling for return to work, law advice, medical advice, because such a service does not exist at the present in Romania, but it could function as a safety net for these persons who are out of our systems because they have accomplished the treatment, so they are out of the medical system. They don't have a job, so they are out of employment, and part of them don't have a benefit, a financial benefit, so they are also out of the security system. So such an agency can be a great source of support for these patients. Another suggestion was to include in the law the possibility to cumulate the sick leave with a gradual return to work of 2 or 4 hours. And actually, this suggestion is taken from the actual legislation for return to work after maternity leave. So there are some positive measures for maternity leave which can be implemented for the workers with cancer which return to work. The following one is the same. It's from the maternity leave to introduce the insertion incentive for workers, which is a financial incentive for those who come back to work earlier. Also, our stakeholders in interviews and in focus groups suggested that they could have trainings regarding cancer and other chronic diseases, also trainings for legislation regarding the impact on return to work, and they need these trainings to have better information, more accurate information regarding all these topics, and also for raising awareness about health prevention and work-related issues. This was my presentation. Thank you, and if you have questions, you can email me at this address.